G'day Thrivers. Today we're talking about the perimenopausal, menopausal vagina and vulva. If this is a topic that freaks you out, feel free to keep on scrolling. We'll give all those people who don't want to talk about it in a minute, and then we're going to talk about it. This is a topic I have really wanted to cover because I think it's one of the last taboo topics. It's something that women don't talk about with their friends over coffee. We talk about a lot of things now that we didn't used to, but I think this is something really important that we should cover because otherwise women end up quite uncomfortable and in quite a lot of distress, and sometimes important diagnoses are missed because A, people don't talk about it with their friends and family, and B, often feel a bit embarrassed to come and talk to the GP about it. And I have to say, after seeing a patient and talking about this a couple of weeks ago, I said to my husband over dinner that I wanted to do this topic as a blog post, and he blushed so hard that it actually put me off doing it. But now I'm going to be brave and we're going to talk about it. So essentially, at the time of perimenopause and menopause, women start losing their female reproductive hormones. Their ovaries start packing up, and we become deficient in estrogen, progesterone, and testosterone as well. The thing about estrogen is that it's really important in maintaining the environment of the vulva and vagina. So it helps keep those areas lubricated, it keeps them stretchy and bouncy, and it helps sort of hold everything up sort of above the pelvic floor. And once you start losing those, you can get atrophy of the vagina and vulva. They can become dry, they can become uncomfortable, things start sitting lower, so you get issues like more likely to get things like urge or stress incontinence as well. There can be uncomfortable sex, and that can mean women don't want to go there because it's uncomfortable, and that can cause issues in and of itself. So my suggestion is, if you're struggling with this or if you're uncomfortable, have a conversation with your GP, because there are things that we can do about it. The first one is that you can use a vaginal moisturizer, like a water-based moisturizer, which is different to a lubricant. You use it a couple of times a week, and it actually helps keep you more comfortable throughout the week. And the other thing we can do, because this is a problem of a lack of estrogen, is that we can replace the estrogen just in your vagina area. So it's not necessarily HRT for your whole body, it's HRT just for your vagina. And because it is a localized estrogen that's just absorbed in the wall of the vagina, it doesn't carry any of the associated risks of HRT that sometimes we talk to women about who want to have whole body hormone replacement therapy. So it's what that helps to do is it helps everything sit up higher again, it helps with lubrication, it helps with just general comfort, and it helps with stretchiness and so forth. And that is something that women can be on from the time of perimenopause or menopause all the way through, for the rest of their lives if they want to, quite happily and safely. So that's something really important to know. The other thing that I wanted to talk about is itch and discomfort, and that is again something that's quite misunderstood. It's actually quite unlikely to get thrush post-menopausally, so itch, unless you're on estrogen, so itch is usually not thrush, so it's probably not that useful sort of endlessly going and treating yourself with Canesten or similar products from the chemist. So there's a variety of causes of itch, vulval itch. One important cause is that you can get a dermatitis there, just like you can get dermatitis anywhere else on the skin. And that can be particularly an issue if you're using panty liners or pads, and also if you're using soap in that area. You shouldn't need to use soap. Water is fine to wash with, or Sorbolene if you really must, but I'd be avoiding soap in that area. And what I would say is, if you are getting itch, again, come and talk to us. It doesn't embarrass us at all, and it's something that we see all the time, because there's another cause of itch, which is like a kind of a chronic dermatitis problem. It's called lichen sclerosis, which causes a thickening of the vulval area of skin. It causes scarring, it causes loss of the normal vulval architecture, and it actually predisposes to a certain type of skin cancer that you can actually get on the vulva as well, and it's not something that we want to miss. So we certainly don't want you sitting at home struggling with an itch that you feel too embarrassed to talk about. So that's a little whistle stop tour through out the perimenopausal, menopausal vulva and vagina. If you've got any questions about that, hit us up and send us a message, leave us a comment, and I'm happy to sort of talk about that topic a bit further. But goodness me, if you're having problems, please just come in and have a chat with us about it, because we do not care. We are not stressed about it at all. We're certainly not embarrassed. And what you probably don't realise is that loads of other people, women, are struggling with the same issue. So please come in and have a chat. Have a good day. Bye.